Okay, moving into we're going to be just quickly, not a real long PowerPoint. I think I've got everything covered in there. This is not going to match exactly with the PowerPoint that you have embedded in your course. The material, the format is a little. So I encourage this out, and excuse me, I'll send this with you also, so that you can follow along if you want. Information is what's. We're going to start with time. Getting ready to do a venipuncture, we need to begin with, of course, our test request. Whether it's manual or computer generated, we need to have a test request, and we also need to identify our patient. The status of the test request will be listed on the, and it will either be stat or as soon as. This reminds you to we talked about this before. It's just the fact that you need to remember to clean the site well and how to use the tourniquet. You don't want the tourniquet on too tightly or too loosely, and not be left on for very long. 3 to 4 inches above. We want to be able to try and flatten that tourniquet under our arm so that it doesn't twist and pinch and hurt. And can't do a full knot, obviously, because you have to have one hand available and be able to release it with just one hand. When you clean that site, concentric circles are the way to go. Start on the inside and then work your way out in a circular motion so as not to go over the same place twice. Don't blow on it or fan it in any way. Just let it air dry. To really, what I want to take away from this is that tourniquets are important things because we want to make sure we don't leave that for more than a minute. Otherwise, you can end up to hemoconcentration. I'm going to talk about today's errors of results. Here are some possible issues we're faced with often in the laboratory. Hemoconcentration is blood tubes, specimen contamination, or a lipid-looking serum. We're going to go into each of these. Hemoconcentration is basically defined as an increased concentration of the larger molecules and formed elements in the blood. This happens from a tourniquet being left on way too long, and blood is not going to continue to flow, so it builds up. When the tourniquet's left on too long, or there's a ton of massaging or squeezing at the site, hemoconcentration will take place. Patients who have had extended periods of time. Also, if you have had a long period of IV therapy, you may see the person has some really occluded veins or sclerosed veins that are very, very hard even to touch. Some of this is due just simply to the fact that their veins have been used way, way, way too much. So hemoconcentration just basically is saying you got the tourniquet on, and if you have somebody that's pumping their fist a lot, this also is going to be involved where the potassium, lactic acid, and phosphorus, they tend to leach out and be increased. The word hemoconcentration, keep in the back in your mind so that can cause problems. Obviously, if I'm drawing a potassium and left the tourniquet on way too, and it was an older patient talking to you and pumping his fist the whole time, you may come up with a very high calcium, which, if the gentleman was not high, might cause a change in his medications. It's important to know hemochemistry and the reasons that and what the effects are. The next on the list was hemolysis. If you'll look at these 4 tubes that I have on slide here, you'll see that there are 4 tubes. At the far left is perfectly normal tube. Move to the right, they become more and more hemolyzed. Once that red cells have been destroyed and the hemoglobin cells has been, so has the intracellular. The largest found intracellular analyte calcium. So if you have a very hemolyzed and you to do, you'll need to redraw. You don't want to deal with a specimen that is bright, because you're going to have a false potassium. Other stuff. That hemolysis occurs, clean the site with alcohol. You go ahead and pump right away. Alcohol can actually cause hemolysis. If the patient has a hematoma, never draw around that hematoma. That also is hemolysis because you've got blood in that area that is already red cells. You draw a tube that has, it's real important not to shake the head. Just invert it a couple, because if you shake it real hard, bust up red cells and hemolysis would result. Using a syringe, the thing to remember is we've seen more hemolysis if the needle is not securely adhered to of the syringe, so there's a little bit of air that leaks in there. That's one of the hemolysis. The other one is just simply pulling back way too hard and too fast. So hemolysis is going to be another problem that will interfere with a lot of our blood tests. If we have to read something by light, you know that you wouldn't be able to read through that very well. Some more errors would be a partially filled tube. Now, all the tubes we've talked about in the ETS system have a negative air pressure in them and should be filled until they stop filling, because they are in such a way that the exact amount of blood needed to fulfill the requirement of that anticoagulant, that's exactly how much air pressure is in there. So it should amount. There is, that is the light blue one, the sodium citrate tube for coagulation. That tube has a special anticoagulant to blood ratio. That's that tube is filled. If it's not, the ProTime and the APT falsely, the patient may end up being treated for something that she not be treated for. So sodium citrate is probably the number one that gets refused. It does not get filled correctly, too full. It can cause some problems with under. It's not necessarily the mix as it is that mixing that anticoagulant with an underfilled to stabilize the red cells. Morphology issues, but it also you're going to have a decrease in and possibly in. So it's important to watch them. For errors could be if they're needed. In the course, it talks about IV. If somebody is on an IV, avoid the arm that the IV is in at all costs because you don't in, and you can't draw anywhere below an IV. Draw from an arm that has an IV in it. It's very possible lavender, and this is kind of a terminology thing that was in the book that I really liked. But it's stop, light, red, green light, go. Remember that the first letter of marching. 0 blood cultures, 2, 3 is S, 4 is 1 serum, plasma. Like to get all drawn before the we have the gray tube. Last slide here is just talking about a few other things. Basically wanted to make sure that we made note of the fact that problems can happen in a laboratory if the breakdown of communication is a problem. All the physicians that are dealing with a patient need to communicate amongst themselves with the nursing staff and the lab staff to make sure that everybody's so that the patient only has to be drawn at one time for these tests, or if they're a special time, that's different. But we want to coordinate our lab requests so the patient has the least number of sticks for what he needs to have drawn. It's important to maintain a log of frequency or volume collected for patients, particularly when you have a NICU or a ICU for infants, because those are the ones that so easily can get the anemia due to blood loss. Also, it's good to monitor the number of times that a patient is punctured in one day. You know, we have staff that comes on at all different hours of the day, so if my 5 o'clock staff drew Mabel Martin, say 3 times from 7 to 11, and the staff that comes on during the day will say drew her once, and then after 6, a new group of nurses come on, a whole group of young interns. Anyway, all these people come on, and 6 more times the patient is stuck between 6 o'clock and 10. That needs to be handled because nobody should have that many blood draws in a short period of time. If they're going to have multiple blood draws done because of their timed draws, they need to just communicate that with the lab and we'll be good with it. Communication and understanding the pieces makes everybody successful. So that is it for the PowerPoint for this week. I will